Hello, Partnering for Vaccine Equity learning community members and others working on vaccine equity, and welcome to this afternoon's learning event. My name is Kristen Brown, and on behalf of the team at the Urban Institute, thank you for joining us today. This is the third learning event in our Social Determinants of Health series, which we are currently hosting on the third Wednesdays of each month. Today, we will hear about what the changes in Medicaid enrollment policies may mean for your community. States have had to maintain Medicaid coverage for most enrollees since the start of the pandemic, but the continuous enrollment requirement ended on March 31st, and states have begun to redetermine eligibility for Medicaid. Recent estimates indicate that around 18 million people could lose coverage during this 14-month process. Today, Urban Institute featured speakers will explain how Medicaid redetermination works and what Medicaid enrollees must do to maintain coverage if eligible. Before we go further, I'll do our typical review of how this session will work. You've all been muted upon entry to this session. There are a lot of us, so staying on mute is key unless you are speaking to keep the discussion going without accidental interruptions. You do have the opportunity to speak your question rather than type it into the Q&A. It is your choice. If you want to speak your question, use the raised hand feature and we'll unmute you. If you want to type your question, use the Q&A tab to do this, and you can ask a question at any point during the session. The chat room feature is also open today, and we encourage you to chat amongst yourselves as you'd like, but please use good chat room etiquette. By this, I mean do not post questions for the speaker in the chat because we might not see them there. And though this probably goes without saying, please be civil to one another and to our speaker while chatting. We have live interpretation from English to Spanish during our events. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. Finally, as with all of our learning events, we'll post the slides and a recording of this event on our community website and circulate them through the digest that go out through the CDC-managed Adult Vax Program listserv, which all members should be a part of. If you have technical difficulties at any point during the session, send an email to our community manager inbox at vaxequitylearning@urban.org. We will be watching the inbox and we'll try to help you as quickly as we can. And now it is my pleasure to introduce our featured speakers. First, we have Jennifer Haley. Jennifer Haley is a principal research associate in the Urban Institute's Health Policy Center. Haley's work includes assessing ways states and communities can improve health equity in response to the COVID-19 pandemic, barriers to enrollment in publicly subsidized health insurance coverage, coverage gaps for postpartum women, and challenges to assessing the safety net for children and immigrant families. She also conducts research on other issues related to Medicaid, the Children's Health Insurance Program, and coverage for, and care for children and families. Haley holds a Master's of Arts degree in sociology from Temple University. Next, we have Eric Wengel. Eric Wengel is a research analyst in the Health Policy Center, using both quantitative and qualitative analyses in the monitoring of the Affordable Care Act marketplaces and private insurance. His research to date has focused primarily on implementation of the Affordable Care Act and the future outlook of the health insurance marketplaces and health reform at large. Additionally, he has written extensively on the competition and market dynamics of the health insurance marketplaces and its interaction with private health insurance more broadly. He has analyzed various health reform proposals actively under legislative construction and theoretical. He graduated from the University of Maryland with a BS in environmental science and policy. So thank you, Jennifer and Eric, for taking the time to speak with us this afternoon. Jenny, I will hand things off to you now.
Thank you so much, Kristen. We can start with the next slide. So I'm going to start us off with going through policies related to Medicaid enrollment that were enacted during the pandemic, and then an overview of what's changing now as we enter this new phase, and then I'll hand it off to Eric for some more details on some of those pieces. So the next slide just gives overall picture of what health insurance coverage looks like among the non-elderly. Now, this is 2018 data, so things have shifted, as you might imagine, related to some of these issues we're going to talk about today. But just to give you an overall sense, if you think about the non-elderly population, the most common type of coverage you can see, this is a pie chart showing about 5 different coverage statuses. And the biggest one at about 6 in 10 people who are non-elderly, that's adults and kids. The most common coverage for 6 in 10 is employer-sponsored coverage through someone's job. And the next most common group is those with Medicaid or other public coverage at about 21.5%. And so that includes Medicaid, the Children's Health Insurance Program, other public coverage, and a small number of non-elderly people who are in Medicare. The third most common coverage type shown in this chart is those who are uninsured. It was 11% according to this survey in 2018. And then the 2 smallest groups are those in marketplace coverage, which you might also know as exchange coverage or Obamacare. Those private plans, many of which people can get subsidies for, is about 3.8%, and then 3.7% in other private or non-group coverage. So of course, this varies according to different surveys, but just to give you an overall sense, a couple of takeaways from that are that there are, a number of uninsured people, but that Medicaid is a really common and really important source of coverage, especially for those who don't have access to employer coverage. There's state variation for sure in this distribution for a number of reasons. But I also will quickly just note before we move on that that's among the non-elderly. When you think about the over 65 population, almost everyone has Medicare coverage. So it's a really different scenario. So focusing here, as I said, on Medicaid, we can go to the next slide. So this is going to talk about what Medicaid policy changes were enacted during the COVID-19 public health emergency, or PHE. So you may remember that early on, just as we were all learning about COVID, the federal government officially declared a public health emergency. And then in March 2020, Congress followed that with a number of pieces of legislation. And one of those was the Families First Coronavirus Response Act. And what that did in terms of Medicaid was establish something called Medicaid Continuous Coverage Requirement. And what that meant was that states were prohibited from disenrolling people during the public health emergency, or PHE, for the extent of the PHE, unless they moved out of state or died or asked to be removed. And in exchange for doing that, the federal government would enhance the funding that the states get. So Medicaid is jointly funded by the states and the federal government. And the federal government said, we'll be sure to give you a little bit more if you can promise to keep people enrolled, because and the idea was it's important for people to have health coverage during a health emergency. So all states took advantage of this option. They paused eligibility redeterminations, and they couldn't remove anyone from Medicaid, even if their income changed or they were a child and aged out of the child category that they were eligible in. And the other thing is, not only could people remain eligible, but they didn't have to reprove their eligibility. Normally, people have to periodically renew or get their coverage redetermined, and that might consist of proving that their income is still below thresholds, proving they're still at that residence or whatnot. And so those processes were, for the most part, paused, and people were not removed. The other Medicaid policy piece that I'll briefly touch on is this eligibility pathway that some states established, where they could use Medicaid funding to pay for COVID-related vaccines or testing or treatment for those who were otherwise uninsured. But that's not really what we're focusing on today. I just wanted to mention that briefly. So what did this continuous coverage requirement mean for Medicaid enrollment? This is a figure from the Kaiser Family Foundation. And along the bottom, you can see the dates starting from February or March of 2020 all the way through to the end of 2022. And then on the other axis, you see the millions of additional Medicaid and CHIP enrollees in each year. And so what this shows is a pretty steady increase this entire time, so that over the course of the time from the beginning of the pandemic till the end of 22, there was an increase of 21.2 million more Medicaid and CHIP enrollees compared with February 2020. Now that's about a 30% increase, just really, really large. And if you look just at this number among adults, it's actually about a 40% increase. So I know that's the target population for paid programs, so just wanted to mention that. So this is really an unprecedented growth in Medicaid enrollment. Some of this is probably due to additional people who signed up for Medicaid. For instance, they lost their jobs in April 2020 as things shut down. They lost their employer coverage. They went and got Medicaid. But a lot of it appears to be people who would otherwise have disenrolled over this time and who didn't disenroll. And we saw related declines in uninsurance over this time. So that's kind of the stage of what has happened up until now. And then the next slide is going to go over what is changing here in 2023. So I said earlier that the continuous coverage requirement was linked to the public health emergency. But what Congress did at the end of 22 was delink that continuous coverage requirement from the PHE. So, you might remember the public health emergency kept getting extended in these little increments, and that's really hard for the states to plan for. So they said, as of the end of March 2023, the continuous coverage requirement is ending and states may resume eligibility redeterminations. So states have about 14 months to process redeterminations for all enrollees over that time. It's worth thinking about what a big deal that is for the states. It's a very heavy workload. It's also, I've seen several people remark on the fact that there may be caseworkers and staff at the agencies who have never processed an eligibility redetermination before because they've been there at a time when there hasn't been that process going on. And there are probably a lot of enrollees who've not gone through the renewal process and really don't know what to expect. I mentioned before this Medicaid eligibility pathway for the uninsured, and that is, as I said, only in a few states, but that's also ending when the PHE ends. So the next slide will go over what do we think is going to happen in terms of health insurance coverage as this, what they're calling the unwinding of the continuous coverage requirement. So as many as 18 million people are projected to lose Medicaid during this process. That's a very large number. The estimates vary across different sources, but I've not seen one that is not alarmingly large like that. Now, some of the projections have tried to break out why are people going to lose Medicaid. And a substantial number are expected to lose Medicaid because they're no longer going to be eligible. So when they enrolled, their income was lower. Now they've gotten a new job, for instance, their income is higher. It's above the threshold for their state and their age, their category, and therefore they're not eligible for Medicaid anymore. So if they lose Medicaid in this process, they will become uninsured unless they can transition to another type of coverage. That could be a marketplace plan, that could be an employer plan, it could be the Children's Health Insurance Program for kids. Eric will talk a little bit more about some of those transitions. The other reason that people may lose Medicaid is that they remain eligible, but the process of re-enrollment may mean they lose the coverage anyway. These reasons are called procedural reasons. So I'm going to go through a few reasons here. For instance, let's say the state sends them a letter that says it's time to renew your coverage, but they have moved. The state did not know where they live now, so they never get the mail. maybe the same thing, even if the state is sending a mail and an email and a portal message, if any of their contact information has changed, they won't get it. They may get it, but find it confusing. It's definitely a confusing process. In good times, and probably especially confusing right now with so much changing. It might not be in the language that they prefer. They may have trouble accessing the documentation they need to prove their eligibility. So for instance, let's say someone has a job that's just a cash paying job. How do they get documentation together? Things like that. And then the other issue is that with any of these challenges that folks might face, they would ordinarily be able to contact a community assister. So there's a term called a navigator. That's someone who can help people get coverage. And the state may have a hotline for help. There are resources, but if everybody who's enrolled in Medicaid is going through this process at the same time, those resources may become overloaded and it may be hard for folks to get the help they need. The other projection I've seen is that folks are worried that people of color may be more likely to lose coverage for these procedural reasons. So really important issue. The next slide is from some of our colleagues here at the Urban Institute, and it shows what they project will happen to people's coverage when they, among those 18 million who might lose Medicaid after the end of the continuous coverage requirement. And so this, you can see on the left, it shows the 18 million Medicaid enrollees, and then on the right, it shows where they think their coverage will fall out. So the largest group is expected to be those who have employer sponsor coverage. So they may become disenrolled from Medicaid, but enroll in an employer plan. These researchers projected that's about 10 million people. The second largest group, unfortunately, is 3.8 million who they think may become uninsured. They maybe have, for either of the reasons that I mentioned before, either becoming ineligible or procedural problems. They project about 3.2 million will move from Medicaid to CHIP. About 1 million may get non-group coverage and about 500,000 other public coverage or non-ACA compliant coverage, more limited plans. And so what this suggests is just that it's going to be really important. We want to try to support as many people as possible into moving into ESI or CHIP or other coverage, such as the marketplaces, rather than falling into that uninsured category. Now, the next slide, I just wanted to briefly touch on state variation. As in everything with Medicaid, it varies by state. So the eligibility thresholds that people face for whether or not they can qualify for Medicaid already vary a lot by state. You may know that some states have adopted the ACA's Medicaid expansion, for instance, and some don't. They also vary a lot by people's age. Children's eligibility tends to be higher than adults' eligibility, and that also varies a lot by state. States do have to follow certain federal rules about this, quote, unwinding process, but they do have some control over the date at which they are beginning to terminate people. And so this is a map that shows the dates that different states are going to begin, that they anticipate beginning terminating people from Medicaid. What it shows is that 5 states, Arkansas, Arizona, Idaho, New Hampshire, and South Dakota, have already started disenrolling people from Medicaid as of April 1st. And the rest of the states are expected to do so beginning quite soon. It shows that about 14 states are going to begin disenrolling people in May, another 22 in June, and 19 in July, with one state, Oregon, doing so in October. So again, the name of the game is often state variation, but it's really coming up soon for almost every state. And then the last slide that I will present here is just to let you see a little bit of evidence about how much this period of transitioning, even in the best case scenario, let's say someone's losing Medicaid and they're eligible for marketplace coverage. That's great. They're still eligible for something, but that process of transitioning between coverage types or renewing coverage, even if they remain eligible for Medicaid, can be really challenging, and a lot of people can lose coverage. So in 2020, a survey found that 3 in 10 people who had lost Medicaid or who were the parent of a child who had lost Medicaid in the past couple of years before the continuous coverage requirement said that the reason that they had lost it was because they couldn't complete that renewal process. It was just too burdensome. And then there's a figure on the bottom here from MacPac, and it shows groups of along the bottom, you can see adults versus kids, and it shows various coverage transitions. So for instance, it shows moving from marketplace or exchange coverage to Medicaid, moving from Medicaid to exchange coverage, moving between CHIP and Medicaid. And then it shows the share of people with those various combinations of movement between programs who had a gap in coverage. So they did successfully move from Medicaid to marketplace coverage, but they had a period where, it wasn't like the Medicaid ended on the 31st of the month and their marketplace coverage started the first of the next month, and they were continuously covered. And what it finds, for instance, is that among adults who move from Medicaid to exchange coverage, 70% had a gap in coverage of some point. And so what this shows to me is that even if people are able to successfully connect to other coverage, they may have a gap in coverage there. And that's just, of course, always worrisome. It's especially worrisome in the, ongoing, even if we're not in a public health emergency, we're still in a place where we don't want people to have periods without coverage. It could really be very worrisome for their access to care for COVID and otherwise. So it's going to be really important to make sure that people are able to connect to other coverage. And Eric, I will pass it to you now for talking about some of those resources.
Perfect. And so thanks so much, Jenny. And then before I start, I just want to apologize to everyone for sending out so many emails, but I actually have a chance now to make this apology in person. Okay, so then moving over to what coverage options are available to those who are losing access to Medicaid. And then this is where you all may be able to provide some help, since you're in a fantastic position as trusted messengers within your communities. You may be able to help facilitate some of these coverage transitions, or help make sure, as Jenny mentioned, help make sure that you maintain Medicaid coverage for a lot of folks. Can you go to the next slide, please, Sophia? Perfect. Okay, so many enrollees who are losing access to Medicaid may in fact qualify for subsidized coverage through the marketplaces or exchanges or Obamacare. All of these are the same name. All of them mean the same thing. All of these were the marketplaces were established under the Affordable Care Act. The exchanges and marketplaces initially went live for the 2014 plan year. Healthcare.gov had a few issues, as some of you may remember, in 2013, but the platform is stable now. And it is an excellent avenue for people to get coverage. Originally, under the Affordable Care Act, individuals and families with incomes between 100 and 400% of the federal poverty level were eligible for financial assistance, and also who had no access to affordable employer coverage, which I believe is 9.5% of annual premiums, is what that is classified at. 9.5% of your annual income cannot be paid towards premiums. Usually, this is only available during the open enrollment period, which is traditionally November and December. Some states it moves into January a little bit, but for all intents and purposes, November and December. However, right now there is a unwinding special enrollment period, or a special enrollment period, where if you do lose access to your coverage, you can submit a healthcare.gov application between March 31st, 2023 and July 31st, 2024. and you'll have 60 days after the loss of coverage to select a new plan on the marketplace, which will start the first day of the month following your plan selection. Now we say 100 to 400% here. That has been changed a couple times, which next slide, please, Sophia. Which these are the new eligibility thresholds for people who get for financial assistance in the marketplaces. So as income falls, people get more help paying for their health insurance, and it's on a sliding scale. So up to 150% of poverty. So that's 100 to 150% in states which have not expanded Medicaid, and in states which have expanded Medicaid, it's 138 to 150% of poverty. Those folks pay 0% of income towards a premium. So the federal government is paying for their entire share of the premium. Between 200 and 250 is between 2 to 4% of income, and it's on a sliding scale. As you can see, 250 to 300, it's 4 to 6%, 3 to 400 is 6 to 8.5% of income, and over 400%, the household pays no more than 8.5% of income. And this is new change, initially through the American Rescue Plan, and then followed up subsequently through the Inflation Reduction Act. And these subsidy schedules are also more generous than they were previously through the standard Affordable Care Act. And as it currently stands, this additional or enhanced subsidies should be available through the end of 2025. Next slide, please. Okay, and then there's some additional help for paying with out-of-pocket costs, because access to coverage is not the same thing as access to care. And oftentimes with the marketplace and individual and just insurance in general, deductibles can be quite high. Out-of-pocket maxes can be quite high. To the point where it restricts a person's ability to actually go and get care. And so people who are eligible for these additional subsidies called cost sharing reductions are people or families with incomes below 250% of the federal poverty line or federal poverty level. And there's 3 different types. There's the 94% actuarial value, which means that the plan pays for 94% of all covered or all healthcare costs and associated year. People who are eligible for that are the 138 to 150, between 150 and 200. Those people are eligible for a 87% AV plan. And those between 200 and 250 are eligible for a 73% AV plan. All of these are variants on a silver level of coverage, in which a person has to enroll in a silver plan in order to get the variant that they are entitled to. As I said, high deductibles, large copayments, and coinsurance can prevent people from being able to afford care and access care. Even though they may have insurance, they may not actually be able to use it. And so the ACA has provided this additional form of subsidy to make sure people can actually use their coverage that they have purchased. Next slide, please. Okay, and so it comes to the most important part here. So what can the community do to help with these upcoming transitions? Increasing awareness, first and foremost, according to a recent-ish Urban Institute survey from June of last year, most adults with family Medicaid enrollment were not aware of the upcoming return to Medicaid renewals. A lot of people who've been enrolled in Medicaid have never gone through a Medicaid renewal before. So we need to remind people that are currently enrolled in Medicaid that you need to re-verify their eligibility through the state Medicaid agency, healthcare.gov, or their state marketplace. Healthcare.gov, even if your state runs their own marketplace, healthcare.gov will direct you to where you need to go. It will direct you to the state Medicaid agency or to the state marketplace, whichever is the correct avenue to ensure people are able to maintain their coverage. If they do not re-verify their eligibility, they will lose their coverage even if they are still eligible. So this is incredibly important to do. Everyone should verify their state has the most updated contact information, as Jenny said. Some people have moved, some people's living situations have changed. Make sure your phone number is up to date. So phone number, address, so states can reach their Medicaid enrollees and can re-verify them even if they're still eligible. People who do receive a Medicaid termination notice can appeal, and if they are still eligible, due to their income level being within the eligibility thresholds, they should be re-enrolled. Make sure people know that if they lose eligibility for Medicaid because their income went up, they still may be eligible for significant financial help paying for private insurance. And as I said before, the Affordable Care Act and American Rescue Plan and Inflation Reduction Act have made significant strides towards improving the affordability of private health insurance. And so there's many avenues. People can enroll in low or zero cost plans in many states, between bronze and silver plans and even gold plans in some instances. And so you can get some pretty generous coverage with a significant amount of financial assistance. This is a new bit of information. Employers must allow eligible workers losing Medicaid to enroll in their employer plans until September 8th of this year. Ordinarily, in employer-sponsored coverage, you are only eligible to enroll during a special enrollment period during a life event change, or during your open enrollment period through your organization. This year, employers must open up a special enrollment period until September 8th to allow people to enroll who are losing coverage. And so the main thing that you all can do to help is to guide people to healthcare.gov or to navigators, or if you're a navigator yourself, you can help people through this process, or their state Medicaid agency. But really, healthcare.gov is a good one-stop shop where you can direct people to where they will need to go. Navigators are also an incredible resource who can help people walk through the plan choice and help choose what's best for them. Next slide, please. Okay, so when consumers can get information on coverage options. You can enroll in Medicaid at any time of year. There's no open enrollment period for Medicaid. Whenever you are eligible for Medicaid, you can enroll in Medicaid. In order to enroll in private insurance not obtained through an employer, so the marketplaces or off marketplace, most people must enroll during the open enrollment period, which, as I said earlier, is traditionally in November and December. Some states it goes into January, but those are just the state-based marketplaces. The vast majority of states, the open enrollment period is in November and December. Some people will qualify for what is called a special enrollment period during the year if you've experienced a significant life event, such as losing private health insurance from another source, like if you lose your job, and your source of insurance through, if you lose your ESI, you're eligible for a special enrollment period through the marketplace. If you've lost eligibility for Medicaid, you receive a special enrollment period where you can enroll in the marketplace. If you've moved to a new state, that is a qualifying life event. Getting married, having a child, or a significant change in income, also like losing your job, also qualifies as a special enrollment period. Next slide, please. Okay, and this is an important part here. So many of the uninsured still do not know that financial assistance is available to make insurance coverage more affordable for them. A survey done by the Urban Institute in 2021 found that fewer than 1/3 of the uninsured had heard either a lot or some about the fact that the health insurance subsidies are available through the marketplaces. A survey similarly, a survey done by the Kaiser Family Foundation in 2020 found that only 14% of uninsured people who live in the 38 states that had expanded Medicaid knew that their state had done so. However, more than 80% of the uninsured said they would likely enroll in Medicaid if they were eligible. And there is obviously considerable amounts of evidence that the information provided by trusted messengers and trusted members of the community can increase the chance someone will actually enroll. And this is where we go back to the most important part here is awareness. There are so many people who just don't know about the marketplaces and don't know that there's financial help available to them. They hear private health insurance, they think it's too expensive, without knowing about the potential financial assistance that's available to them. A significant number of people who are eligible for Medicaid don't know that they're eligible for Medicaid and don't know how to get Medicaid. And so just increasing awareness of these available avenues for coverage can go a long way towards easing these transitions. Next slide, please. So how can a consumer find out whether they are eligible for Medicaid or subsidies through private insurance or the marketplaces? So the federal government runs the health insurance marketplaces in many states through healthcare.gov. And some states that run their own marketplaces do it through healthcare.gov, but that's a little weedy. We don't need to get into that. Some states do run their own marketplace. I believe there are 14 currently that do or have their own website. I'm sure if you live in those states, you are aware of their branding and their name. However, no matter what state you live in, healthcare.gov can guide consumers to the right information. When you log in, if you're looking to purchase or find out what you're eligible for, it asks immediately what state you live in. And then if it's a state-based marketplace, it will direct you to that website immediately. If you input your income already, it will send you to the state Medicaid website. If you go to healthcare.gov and your state runs, or your state does not run its own marketplace, then healthcare.gov will take you immediately to the application. You can browse, see what's best for you, or if you're eligible for Medicaid, it will send you to the Medicaid agency. There are some downsides here. You do need an email address and access to a computer and internet to shop electronically. You can also, and this is where navigators really come in handy, since they have so much information, so much understanding of these incredibly complex systems, and health insurance itself is very complex. No one knew it, but and the amount of help they're eligible for by talking to a navigator, you can find that. You can also find this on healthcare.gov, but navigators are trained to help them. Healthcare.gov also has a navigator search function to find the navigator closest to you. Just click the find help link on any marketplace website, and healthcare.gov has it as well. Next slide, please. Okay, so here we have two figures on the left in reference to some people who may become uninsured. And this is, we're going to talk about the coverage gap for a second here. On the left-hand side, you will see a map of the United States. You see the 38 states that have adopted Medicaid in a dark blue. In a lighter blue, there are 2 states, North Carolina and South Dakota, which have adopted Medicaid, but it's not yet implemented. So hopefully people will be able to enroll in Medicaid in those states shortly. Now, there are 10 states which have not adopted Medicaid expansion. And those are Wyoming, Wisconsin, Nebraska, Texas, Alabama, Mississippi, Georgia, South Carolina, Tennessee, and Florida. And so in those states, it becomes difficult because we have what is referred to as a coverage gap. And that's the figure on the right here, where we have a time or a line of eligibility thresholds where we have between 0 and 38% of FPL, which is the median eligibility threshold for the non-expansion states. And the marketplace subsidies don't kick in until 100% FPL. And so between 38% and 100%, there's no financial assistance available for people who fall into that group. And now, Sophia, I think here I'd like to show a diagram, or it's a table that I found, a helpful resource here that should help people who don't have access to coverage, so we can see what the cost will be for vaccines specifically as the PHE, or as the Medicaid continuous coverage provisions come to an end. So here we have a chart. Zara has also placed it in the chat. So during the PHE, we see what the cost of COVID vaccines were during the PHE, Medicare, Medicaid, CHIP, private insurance, uninsured children, uninsured adults. It was free. Now, after the PHE ends, Medicare, Medicaid, CHIP, still be free. Private insurance, this is where it will be free if you go in-network. If you receive your vaccine from an in-network provider, due to the preventive health measures under the Affordable Care Act, which there is pending litigation determining whether or not those will remain. But for now, we're going to operate under the assumption that those still exist. So for private health insurance, it will be free as long as you go through an in-network provider or facility. Uninsured children, it will still be free through the Vaccines for Children program. Uninsured adults, it will cost money for most people. There are avenues, which we will show shortly, where they can still access free or very low cost vaccines. Treatment is going to cost money in most instances, whereas it was free during the PHE. Medicare, it will cost money. Medicaid and CHIP will be free through September 2024. Private health insurance, it will likely depend upon your copay structure, your copay and your deductible, but you will almost and it depends on your coverage. Some will provide coverage at no cost, but in a lot of instances it will cost. And then for the uninsured, it will almost certainly cost. And then testing, it will, again, private insurance, it will depend. It also depends on what state you live in. At-home tests will almost certainly cost money. And then the uninsured, it will cost them money as well. Can we go back to the presentation? Only a few more slides, and we'll have a little bit of time for questions. Next slide, please. Thank you. Okay, so how can we help uninsured people obtain care and vaccines? So as we said, some people losing Medicaid. I think it's around 3 million people who are currently enrolled in Medicaid. We anticipate we'll lose, or we estimate we'll lose access to Medicaid and become uninsured. And they may not be eligible for any form of affordable coverage. FQHCs are incredibly valuable, and other safety net providers often offer free or low-cost care in many instances. We have included a directory here where you can search and find FQHCs local to your area. Current COVID vaccine supply remains free even after the PHE ends, so anything that has been purchased by the federal government and distributed to states will remain free until they run out. And so this is a messaging opportunity where you can get people vaccinated and boosted ASAP while it's free. Limited supplies. Next slide, please. And we have a couple links here for customizable resources. The National Resource Center for Refugees, Immigrants and Migrants, NRC RIM, with the International Rescue Committee and Migrant Clinicians Network, have made multilingual, customizable handouts and PDFs and flyers, both for Medicaid and the PHE ending. We've put the link there. We'll obviously send out all these resources as well. And then also Georgetown University, the American Academy of Pediatrics, and GMMB have prepared state-specific customizable flyers. At that link there, it's just a box folder where you can click your state, and it will have information for whatever state you need. Next slide. And here are some additional resources that we're going to put into the chat now that can help people maintain coverage and provide information ways to help people ensure their coverage, make sure they have access to Medicaid if they're still eligible, or find alternative forms. And then next slide, please. Okay, so what activities in your community are helping people stay covered? You can just share your ideas and activities in the chat. And then also we have time. I actually know the people who put that together, Audrey. I will search for it. We will reach out to them and try to find an alternative solution. Thank you for pointing that out. And also, if you just have any more general questions, please go ahead and ask them in the chat or Q&A, and we'll be happy to answer. Yeah, I actually, that's a really good point, Audrey, an idea. I think anytime you can partner with a navigator or have brokers, at any time you can have them at an event to help facilitate those coverage, or just at the event itself, is really excellent idea.
Yeah, I agree. I would love to hear if anyone has an experiences to share about, maybe a vaccine fair or another type of event where any navigators were present and what conversations may be going on. I'm curious. I know you all have such great connections with the folks in your community. And also whether, the evidence from surveys and focus groups suggests that a lot of individuals are not aware of this change, given all the other, COVID-related news that people have had to process. And so curious to hear what folks are saying in your communities about coverage and awareness about Medicaid changes.
I don't know off the top of my head, Danielle, unfortunately. That is good to know that I guess it sometimes lags. I can dig into that real quick though. And as always, that is a very good point there, Carla. Every state, specifically with Medicaid, is different. And so the best way to find out what your state is doing is to go to your state Medicaid agency, go to Covered California, in the case of California, which is their state-based marketplace website. All of these agencies and websites have a ton of information available about what changes are happening.
These are such great ideas for communicating with the community about the changes. I don't know if you all have seen any of the advertising that the states are doing, asking, I've seen a lot of state-specific agencies just reminding enrollees to update their information. That's been a really key message leading up to this period of making sure they can reach all of their members. So you may have seen TV or online ads.
I see that Rosanna has their hand up. Rosanna, do you want to come off mute and share whatever question you may have?
I think you have to give her permission.
Oh, you're right. Go ahead, Rosanna.
Hi, can you hear me?
Yes.
Okay, so something that we are doing, I'm at UAMS in the state of Arkansas. We have a community healthcare worker at a local library. Basically just letting people know that if they do have Medicaid or have questions about losing their coverage, that they are able to help, and they basically guide them with that process.
That's fantastic. Community health workers are such an amazing resource for connecting folks. So is that sort of an open walk-in type of scenario?
Yes. So
Mhm.
basically, they're there twice a week for half a day. And that's just for now. Maybe it'll be longer or more days later, but for now, that's what we're doing to see what kind of response we get.
That's great. Is that through your organization?
Yes, it's one of our CHWs.
Great. And Danielle is saying they're a housing organization. And so I think that's definitely ties into the social determinants of health theme of this series of having folks work together across all these different areas.
And Danielle, I was able to dig around on that resource in the database. They say it has been updated as of today. And it does actually appear that they're in the process of uploading it right now. So I don't know. I mean, now would be an excellent time for them to keep that resource up to date. And so hopefully that is true, but I can't say for certain one way or the other.
We would be happy to help with any other questions folks may have. I just shared some additional resources in the chat as well. There's really a lot of attention to this issue. So some resources from a variety of organizations, including thoughts on how community-based organizations specifically can play a role. It's that the evidence suggests that the importance of community-based help to navigate the re-enrollment or application processes is just really, really key to helping people get covered or stay covered. And our presentations always and our slides always go up on our resource hub.
And for this specifically, I think, yes, they do go to the resource within the website. They will live in the resource library. We'll also, I think, put a discussion post on the website with all of these links in it, just so it's all on easy access to one place. we go to the next slide, Sophia? Sorry to cut you off, Jen. And let's, if you can take the time to fill out our satisfaction poll, we'd really appreciate that. Thank you. We do have a couple more upcoming events, I'm sure, as you've seen in the copious emails I've sent out. We have the CDC's Vaccine Activity Planner on Monday, April 24th from 3 to 4 p.m. We have another event on vaccine access after the end of the public health emergency. What's changing, what isn't. That will be on May 2nd from 1 to 2 p.m. And for that one, we have a few CDC representatives who will be speaking with us then. And then as part of Mental Health Awareness Month in May, we're going to have a series of, we have a series of mental health workshops and a webinar we have planned. And the first one is going to be desk yoga for the seated employee on Wednesday, May 10th from 12 to 12:30. I think we'll hand it back to Kristen if there's nothing else.
Well, just want to say thank you, Jenny and Eric, for this awesome presentation. I think there's so much that the learning community is going to be able to take away from it today. So everybody enjoy the rest of your day, and it's great seeing you all once again.